Hello people, in this video we want to look at PyeloNephritis. This is the itis, that is the inflammation of the renal pelvis. Okay, so this is the kidney, so here is the renal pelvis. So if the renal pelvis is inflamed, it can be called as PyeloNephritis. Here, this is a tubulointerstitial disease. Okay, this is a tubulointerstitial disease. And here in tubulointerstitial diseases, there are two types, infective and non-infective. In infective, you come across this acute pyelonephritis, chronic pyelonephritis and tuberculous pyelonephritis. In the non-infective, you have the nephropathy. Now, in the pyelonephritis, as we told you, there is acute, chronic and tuberculous. We will be looking at the details of the chronic pyelonephritis. However, we will just take a quick look at what acute pyelonephritis is also. So basically, acute pyelonephritis is an acute condition, that is, it is sudden in onset. So it is an acute suppurative inflammation of the kidney caused by pyogenic bacteria. So remember, all of these are infective, all of them have bacteria, okay? But acute is, it is sudden in onset and it is the inflammation of the kidney caused by pyogenic bacteria. Here basically the kidney will be swollen, it is inflamed. So this is an inflammatory reaction, the kidney is swollen. So this is acute pyelonephritis. So basically here, the most common reason is an ascending infection, a urinary tract infection that ascends. A urinary tract infection usually is caused by E. coli bacteria. So there can be an ascending infection or a hematogenous infection. So look at it in the diagram here. So this diagram represents acute pyelonephritis. So because of ascending infection, or from hematogenous spread, there can be acute pyelonephritis. So the bacteria is either coming from the bottom or it is coming from hematogenous infection. So what is going to happen? The kidney is going to get affected. So the ascending infection is mainly a UTI caused by E. coli. It can be caused by a lot of other bacteria also like Proteus, etc. Here, as you can see in the gross, the kidney will be enlarged and swollen. So here in acute pyelonephritis, remember the kidney will be swollen, right? And you will see that there can be abscess of the kidney. Okay, you can see abscess, kidney abscess you can see. Microscopically, you will definitely see inflammation, neutrophils, etc. So the kidney is basically enlarged. In acute pyelonephritis, the kidney is enlarged. There can be abscess. And inside this abscess, microscopically, you can see inflammation, neutrophils, etc. So this is a very high level overview of acute pyelonephritis. So here the clinical features will be, fever will be there, the frequency of micturition will be more, dysuria, tenderness will be there, loin pain, lumbar tenderness, and the urine, if you check, there will be a lot of bacteria, there will be casts with pus cells, okay? So there can be WBC casts also because this is an infection, it is an acute infection. Acute pyelonephritis can lead to a lot of complications like papillary necrosis. It can lead to pyelonephrosis, it can lead to abscess, etc., etc. So we are done with acute pyelonephritis. Just take a recap, guys. It is a, what is it? It is a sudden onset infection. Either it can come in ascending fashion because of UTI or it can happen because of hematogenous spread of bacteria. Here the kidney will be swollen. Microscopically, you will see a lot of inflammatory cells, neutrophils, etc. There can be an abscess in the kidney. Now let us move on to chronic pyelonephritis. Now chronic pyelonephritis is also a tubulointerstitial disease which is because of an infection. This happens because of repeated attacks of inflammation and scarring. So basically, repeated attacks will lead to chronic pyelonephritis. So look at the causes here. So the etiology are just two here, reflux, nephropathy and obstructive pyelonephritis. So there are two things here, reflux, nephropathy and obstructive pyelonephritis. What is this? Look at this diagram, you will be able to understand very easily. Now this is a normal kidney. Now this is a chronic pyelonephritis case because of VesicoUreteral reflux. And here you have chronic pyelonephritis because of obstructive uropathy. So there are only two causes they have mentioned here, VesicoUreteral reflux and obstruction. Obstruction because can be renal calculi, kidney stones, right? So here you can see the size of the kidney is reduced. This is something you have to observe. Acute, the size of the kidney is more. Now what can you understand here? VesicoUreteral reflux is there. Hence what happens, there are dilated calyx, and the calyx are usually dilated towards the poles, and here there is irregular scar on the pole, right? You can see U-shaped scar, right? U-shaped scar on the pole. So the cortex has got thinned. You can see here the cortex is thin, and there is a thickened capsule. You can see that there is a thickened capsule. Are you able to see the thickened capsule here? And all these effects are usually on the pole. This side it is normal. The other part of the kidney is normal. Okay, so the poles are affected mainly. This is VesicoUreteral reflux. So the urine is backflowing, retrograde flow of the urine. This can happen because of many reasons. We'll come to that. Now let us move on to the obstructive uropathy, so which leads to chronic pyelonephritis. So there is a kidney stone here or some kind of a tumor which is obstructing the flow of urine. So when the outflow of urine from the kidney is blocked, so the urine comes here and has a backflow. Here there is a dilated pelvis. The calyx are all dilated in all the parts of the kidney, not just the poles. So in the poles also you see the U-shaped uneven scarring. It's a diffuse condition. That means the entire kidney is affected. There is thickened capsule and thin cortex, right? And the kidney will be shrunken. So that was about the chronic pyelonephritis etiology. Let us look at the causes exactly of this reflux nephropathy. So basically during micturition, this is during micturition, this is not something else. During micturition, there is backflow of urine. Why? Because there is shortening of the intravesical portion of the ureter. So there is a congenital absence, or there is shortening of the intravesical portion of ureter. So let's draw this to explain. So if this is the urinary bladder and here's the ureter coming in, so this ureter has an intravesicular portion. This is an intravesicular portion of the ureter. This will be very short, okay, or it will be absent. Because of this, what happens? During the act of micturition, the ureter is not compressed. When it is not compressed, the urine will have a backflow. During micturition, when the person is trying to contract the bladder so that he can urinate, instead the urine is going back towards the kidney. This is because the intravesicular portion of the ureter is very small, or it is completely absent. So the ureter is not getting compressed. It had to get compressed, but it is not getting compressed. Instead, it is open and it is allowing the urine to go back. So this is the reflux nephropathy which is causing pyelonephritis. So there is another thing is the increase in the renal pelvis, right? So what happens in the renal pelvis? The pressure is more. Now this is the renal pelvis. Now in the pelvis, the pressure is more because of the urine being forced, right? So the urine gets forced back into the tubules. Now here what will happen? There is damage to the kidney and scar formation, right? This is very common in patients who have frequent urinary tract infections. So basically this kind of reflux nephropathy, you will see poles. Usually the poles are affected, correct? The poles are affected. The scarring is main towards the poles. So guys, there are two causes to chronic pyelonephritis. Two causes to chronic pyelonephritis are the reflux nephropathy and the obstructive nephropathy. We are done with the reflux nephropathy. Now let us move on to obstructive nephropathy. Now in obstructive pyelonephritis, that is obstructive nephropathy, the outflow of the urine from the kidney is blocked. There is obstruction. So recurrent episodes of such obstruction. Remember, everything here is frequent, recurrent, because of which there is chronic condition. So this will result in renal damage and scarring. Okay. So what are the causes for obstructive uropathy? So you know renal calculi, kidney stones, tumors, right? Blood clots, some foreign body can be there. Some strictures, valves are not proper. There can be inflammation. Again, they are saying a pregnant uterus can be compressing and obstructing. Okay. Fibrosis, again, tumors, trauma. So a lot of cases why there can be obstruction. Okay. So this will lead to chronic pyelonephritis. So guys, did you understand the two causes for chronic pyelonephritis? VesicoUreteral reflux and obstruction. can lead to chronic pyelonephritis. Now let's move on. If a person has chronic pyelonephritis, then what will he come up with? Obviously, an insidious onset symptoms he will come up with. Chronic renal failure, hypertension can be there because the renin-angiotensin system can be affected. Here there is basically the person has recurrent acute pyelonephritis, fever, etc. Recurrent, every time it's happening. Frequency of micturition is there. Bacteriuria, polyuria, dysuria, tenderness, lumbar pain, same thing that they have written in acute episode. So basically here, how will you diagnose? There is an intravenous pyelography which is done and the urine culture can show positive results for bacteria. Main thing you have to write here is it's insidious in onset. Insidious in onset, chronic renal failure, hypertension. Now let us see the gross of chronic pyelonephritis. The gross, the kidney is, we already told you, the kidneys are going to be small, contracted. They're going to weigh very less than 100 gram. There is unequal reduction. So unequal reduction, it's not like a norm, this kidney became like this. No, this can happen in many conditions. But here it is an unequal reduction. You have seen that there are U-shaped scars at the poles, etc. Right? So there is unequal reduction and so you can distinguish it from other forms of contracted kidney. What happens to the surface of the kidney? You already saw that it has U-shaped depressions. There is irregular scarring. And coming to the inside, you can see that there are dilated calyces and dilated pelvis. You have seen it in the diagram already. If you did not see it again. See here, dilated calyx, right? The calyx are dilated and also the pelvis is dilated. Okay, so dilated calyx, dilated pelvis, all these you will write in the gross. Let's move on. So dilation of calyx, dilation of pelvis. So guys, what did you see in the gross? In the gross of chronic pyelonephritis, what did you see? The kidney has become small. It is shrunken, contracted irregularly. So you can distinguish it from other types of contraction of kidney. Then what happens to the dilated calyces, dilated pelvis? Then one more point we're missing. Scarring, irregular scarring. It is difficult to strip off the capsule from the kidney. It is adherent due to scars and there are U-shaped depressions. You have already seen this in the diagram, right? Or you want us to go back and show it again? Okay, look at it again. So you will see that the kidney is shrunk irregularly. You can see that there is scarring, thickened capsule. You cannot separate the capsule from the kidney. Dilated calyx, dilated pelvis. That's all. So we are done with the gross of chronic pyelonephritis. Now let's move on to the microscopy of chronic pyelonephritis. So basically here what and all you have to focus on. If you are asked to draw kidney histology, what will you draw? You will draw a tubule, you will draw a glomerulus, right? These are all glomerulus. So this is a tubule. See, look at what has happened to the tubule. There is thyroidization of tubule. It's a colloid cast. So thyroidization of tubule it is called as. Here you can see glomerulus is hyalinized. So here you can see one more thing, periglomerular fibrosis. So there is hyalinization, there is fibrosis of the glomerulus. Then you can see a lot of inflammatory cells, chronic inflammatory cells. You can see, name the cells, neutrophils, plasma cells, lymphocytes, yes. Then the blood vessel also has got hyalinized. There is interstitial fibrosis. So there is so much of fibroblasts drawn here, interstitial fibrosis. So this is the microscopy of chronic pyelonephritis that you will have to draw if they ask you. Okay. Let's go to the details. Interstitium. What will you see in the interstitium? Lot of lymphocytes, plasma cells, macrophages, fibrosis. And in one variant, you can also see foamy macrophages. So a lot of inflammatory reaction. The tubules you saw thyroidization of tubules will happen. They can even contain neutrophils. Okay. So they contain eosinophilic colloidal casts. Okay. Then the tubules are going to have atrophy. Pelvicalcial system. So what happens to the pelvicalcial system? The renal pelvis and calyces are dilated. This you already know. They will again show chronic inflammation and fibrosis. Lymphoid follicles with germinal centers can be present. Interesting. Lymphoid follicles with germinal centers can be present. The epithelium can undergo squamous metaplasia. So there can be squamous metaplasia also. So you know what metaplasia is, right? So it is going to, the epithelium is going to convert into squamous type. So this is squamous metaplasia. Renal has which type of epithelium? So the ureter, urinary bladder have transitional epithelium. But what about the kidney, the calyx and the pelvis, which they are telling here? The proximal convoluted tubule actually has cuboidal epithelium. Okay, so they are saying the epithelium may undergo squamous metaplasia. Moving on, guys. So what are we looking at now? We are looking at the chronic PyeloNephritis. We are done with the morphology gross. Now we are looking at the morphology microscopy, in which we are done with 3 points. Still 2 more points are there. So pay attention here. The 2 remaining points are the blood vessels. What happens to the blood vessels? You saw there is hyaline arteriosclerosis, they are saying. Okay, there is hypertension because the kidney is having issues. So there could be a renin-angiotensin system. So not able to regulate blood pressure. So there could be hypertension. Glomeruli, what happens to the glomeruli? Again, you saw hyalinization of the glomeruli. Periglomerular fibrosis. You have seen both of these points in the diagram drawn, correct? So this completes the chronic pyelonephritis microscopy. So guys, did you understand that the tubule, what happens to the tubule? Colloidal cast, thyroidization of tubule. What happens to the glomerulus? Hyalinization, periglomerular fibrosis. What happens to the blood vessel? Hyalinized blood vessel, hypertensive. What happens to the interstitium? Chronic inflammatory cells. What happens to the renal calyx and the pelvis? Dilated. There can be lymphoid tissue also. So we are done with chronic pyelonephritis, guys. So just take a recap. It is a tubulointerstitial disease. So basically here there are 2 causes. There is VesicoUreteral reflux and there can be obstruction. So both of these causes can lead to chronic. So what will this patient come up with? He will come up with chronic renal failure, hypertension. He can have dysuria, pyouria, bacteriuria. Did I say? Yeah, this is pyouria, right? Pus and urine. Frequency of micturition will be increased. Lumbar tenderness, loin pain, fever. All these are acute recurrent pyelonephritis. The diagnosis you can make with intravenous pyelography, culture of urine. Grossly, you will see that the kidneys are small, contracted, uneven contraction, that is unequal reduction, irregular scarring will be there. You cannot strip off the capsule. There will be U-shaped depressions on the cortical surface. The dilation of calyces and dilated pelvis can be seen. In the microscopy, you will see that there is, in the interstitium, there is inflammatory reaction, lymphocytes, plasmacytes, macrophages, foamy macrophages, fibrosis. The tubules, you can see atrophy, thyroidization of tubules. Pelvicalcial system, you can see they are dilated. There can be chronic inflammation and fibrosis. Lymphoid follicles with germinal centers. Squamous metaplasia, you will see where they are telling the pelvicalcial system. Blood vessels, there is hypertensive hyaline arteriosclerosis. Glomeruli, you will see periglomerular fibrosis and hyalinization of glomeruli. So that's all for now in pyelonephritis. That is the chronic pyelonephritis we have covered in detail. Okay. Thank you so much for joining. Bye-bye.